Hello, dear students and esteemed learners. Welcome again. Welcome to my course on Sociology of Health. And this is lecture number 23. And today we will talk about sanitation and public health in India. So, you may remember in the previous two lectures, we talked about growth of public health in last 200 years and then growth of public health in Indian context. Now, as we have seen in the previous lectures, public health is a very broad approach and it takes into consideration not only the medical care aspect but also all the social factors and social determinants, right? So, as we saw that during the growth of public health in the United Kingdom also, uh, sanitation was considered very important component of public health. Uh, Wastewater management, sewer system, then construction of good quality roads, taking care of the households and the needs at the level of the household, right? All those components were there, part of public health system. And so those are the essential components. In the second lecture, we talked about the definition given by World Health Organization, and there we saw categorically that public health is taking care of sanitation, then all other such things which can help in prevention of occurrence of disease, right? So sanitation is very important, and in this lecture we will thoroughly try to understand what sanitation is and why do we need and how this is related to public health, right? So the concept that I have covered in this lecture are defining sanitation, and why sanitation, the attributes of sanitation, and major sanitation programs in India, right? So this is how we will proceed in this lecture. We will begin with defining sanitation, and again we will have the definition given by World Health Organization. The definition of sanitation given by the World Health Organization states that sanitation refers to the provision of facilities and services for the safe disposal of human urine and feces, right? So, at the prima facie, we can say that World Health Organization says that sanitation is related to the facilities and services for safe disposal of human urine and feces, right? That is the component number first. Then WHO also adds that sanitation also refers to the maintenance of hygienic condition through services such as garbage collection and wastewater disposal, right? So one at one level we talk about safe disposal of human urine and feces, and second level we are talking about the collection of wastewater and garbages and then their safe and scientific disposal. So these things together will make sanitation according to this definition. Then World Health Organization and UNICEF in a joint monitoring program for water supply and sanitation talked about management of human feces at the household level, because historically the human feces have been somehow getting managed, and what was quite visible was the practice of manual scavenging, because that was the only way through those human feces and urine were actually getting disposed of. And unfortunately, the practice of manual scavenging continued for a very longer period of time. It was only with the arrival of the modern toilets and the modern techniques of basically developing toilets that those past practices actually could get eliminated. So this is very important, and sanitation is talking about this. Then there is one definition given by Elk Mulleger and others, and according to them, the term sanitation comprise all interventions which aim to protect and promote human health by providing a clean environment and breaking the cycle of disease. So they look sanitation in terms of the clean environment, right? So their approach is looking at the environment. If we can ensure a clean environment and take care of all the other aspects or requirements related to that, then that will play a very important role in breaking the cycle of disease, and that will be a great effort to ensure sanitation. That means there are multiple aspects which are related to sanitation. Environmental sanitation is also a very important component of sanitation. So these are two different aspects. Then Dr. Bindeswar Pathak, the founder of Sulabh International Social Service Organization, and who is popularly getting associated with Sulabh Sauchalay or Sulabh toilets, basically something which has really made an impact in the urban lives of people in India. So, Dr. Pathak is also talking about sanitation, and according to him, sanitation includes water supply, safe disposal of human waste, wastewater and solid waste management, control of vector of disease, domestic and personal hygiene, food and housing, etc. That means Dr. Pathak has included several other components in the definition of sanitation, right? And that way we can see that the WHO initially talked about disposal of human urine and feces, right? But gradually, people have incorporated several other things for having a broader understanding of sanitation. Akram, in his book Sociology of Sanitation, says that sanitation refers to adopting the principles, practices, provisions, or services related to cleanliness and hygiene in personal and public life in such ways that one enjoys the beneficial impact on physical, mental, moral, and spiritual well being at personal as well as community level, and ensures that no one else get adversely affected directly or indirectly by the negative impact of human excreta, household waste, garbage, and other pollutants. Now, what is stated in this definition is very important in the sense that when we talk about sanitation, then there are actually the things are happening at two levels. One, who are getting benefited through those services, and then second, who are the provider of those services, right? So when we were having the practice of manual scavenging, then those who were the beneficiary, those who were getting the services, they were not getting affected by the kind of practice, but those who were providing those services or the manual scavengers, they were at the receiving end, and that has created huge inequality and huge deprivation. That we know, that we understand when we study the history of caste system in India, but we are not talking about that. We can understand the situation that when we are talking about sanitation, then there are different types of techniques and facilities for that. So there are certain groups who are providing those services. So if they are getting adversely affected, then that will make the system or the mechanism very weak. So sanitation means something which is practiced very scientifically, so that nobody should get adversely affected by that, no matter whether that is related to the physical aspect of health or the mental, moral, spiritual aspect of the health, right? So that is the broader perspective in which we can try to understand sanitation as per these various definitions. Then why do we need sanitation? I think we all understand that sanitation is very essential for controlling the prevalence of certain disease, especially the communicable disease. So historically and globally, we have seen that the causation of certain disease and certain epidemics also was somehow caused by the lack of sanitation, because certain waterborne disease, then problems like diarrhea, then cholera, all these things are related to the lack of sanitation kind of thing. So I have included some of these points, and then we have also included some of the figures here collected from various agencies, right? A study conducted by World Bank South Asia Water and Sanitation Unit estimated that India loses rupees 240 billion annually due to lack of proper sanitation facility. This is a huge amount. Now you may think that how India is losing this much amount because of lack of sanitation facility. Because of lack of sanitation facility, India is having the burden of communicable disease, right? And because of the communicable disease, there is huge impact at multiple level. One, the burden of seeking healthcare, that is very important, and then the lost work hours basically, because when somebody is becoming sick, then there are huge loss in terms of the lost work hours or life years, right? So if you take into consideration all those consequences, then the number is very very big or huge. Then poor sanitation affects not only the immediate health of the people but the overall development trajectory, right? So whether you talk about economic development or you talk about social development or even human development, all these different paradigms or trajectories of development get adversely affected because of lack of sanitation. And then women, children, poor, vulnerable groups, etc., they get affected most adversely. According to Indian Ministry of Health and Family Welfare, more than rupees 12 billion is spent every year on poor sanitation and its resultant illnesses. Right. So on the one side, certain amount of money, which is a huge amount, is lost because of the adverse impact of the lack of sanitation facility, right? So these are the things which are stated in these slides. You can read these and some of the next slides also, because primarily we are talking about some of the numbers. Then again, in this slide we have mentioned that sanitation related disease and poor hygienic condition cause 2.2 million deaths annually at global level. This is a very big number, 2.2 million deaths because of these factors, right? And out of these, most of them are basically children under the age of 5, right? So cholera and diarrhea, not cholera but diarrhea, basically diarrhea is a very important factor in causing mortality, right? And diarrhea is related to some of the things which could be checked because of good sanitation, right? Then more than 300 million episodes of acute diarrhea occur every year in India. And then there are several other diseases also, like malaria. Now malaria is basically something which is caused because of the mosquito which is carrying those vectors which are responsible for causation of malaria. Now if we are not taking care of the environment where we are living, then that will be a safe place for the growth of those. Safe not for us, but it will be safe for the growth of those kind of vectors basically, right? That means we need to keep our community clean and free from all those factors which may enhance the possibility of growth of those vectors, right? So sanitation is very important. And then this slide is talking about some of the figures also, as per certain estimates, right? So India Human Development Report of 2011 states that almost 50% of households have no toilet, right? So we are talking about the figures which were provided way back in 2011. So the recent figures will vary, but because those were the figures which were available, so I've included those things. So way back in 2011, 50% of the household had no toilets, and open defecation was basically very frequent. It was very much practiced, right? Although we had several sanitation related programs, but the open defecation was still a big problem. And then why open defecation was prevailing? Because there were no toilets or latrines, right? So if you see the NSS 69th round figures, then we get to know that about 59.4% and 8.8% household in rural India and urban India respectively had no latrine facilities, as per the figure provided way back in 2012-13, right? So when this number of households are not having the latrines or the toilets, then that will automatically cause open defecation, and this open defecation is one of the major factor of having insanitation, right? So when we talk about sanitation, we need to address the problems related to open defecation also. Then another important figure is related to bathrooms, right? Because when we are talking about sanitation, then we need to talk about safe water also, right? So a good number of household, rather, if you go by the number, then 62.3% and 16.7% of households in rural India and urban India respectively did not have any bathroom facility. So in terms of the basic infrastructure required for good sanitation, there was absolute dearth, or we were lacking in that, and the various reports do talk about those things. Then we try to understand sanitation, and then what are the important attributes of sanitation, or what are the important attributes of sanitation behavior. Because talking about cleanliness in India, or talking about personal hygiene in India is common, but talking about sanitation is not very common. So we have started talking about sanitation in past few decades only, or I would like to say 1 or 2 decade only, when we had some of the important government programs, right? So still sanitation has not been much explored in the social sciences. So here Akram has made an attempt to identify some of the attributes of sanitation, so that we can understand sanitation and the behavior related to sanitation. We'll quickly talk about some of these things. Sanitation is a conscious and deliberate social act in a modern industrial society. So it's a conscious kind of behavior, it's a deliberate behavior. It is not something which may happen automatically, right? Because if you want to clean your hands scientifically, then you may need to make use of some soaps, right? So that all the bacteria and all the infections that your hands may have should get killed, right? So we need to spend time with the soap and the water in a specific way, in a deliberate way. So whenever someone is coming out from the toilet, he or she needs to make use of the soap, right? So that the hands get clean and those become free from the bacteria or any kind of infection. So it is a conscious behavior. Then it is related with health and well-being of individuals as well as community. It's not only related to the health and well-being of the individual, but health and well-being of the community, because if not maintained properly, then it will cause communicable disease, and communicable disease can spread entire community. So the sanitation related behavior of one person is not confined to that person, but it's related to the behavior of the entire family and primarily the entire community. Then individual acts of cleanliness can contribute to sanitation but cannot completely define sanitation. Sanitation is collectively attainable goal. Now this is again very important. The cleanliness is not same as sanitation, because sometimes we can take care of cleanliness at the personal level, but not taking care of the cleanliness at a societal level or at the level of the neighborhood. Very often we can see the practice that people dispose of the uh, household waste just outside their household. So if this kind of cleanliness will not serve the purpose of sanitation, why? Because this is not followed scientifically. So there are several other things related to this. Then sanitation is not ritualistic or symbolic, it is related to the real practices. Basically, very often we in India have the concept of purity, right? And in purity, basically, the concept of bath is very important, right? Most of the religion basically follow the concept of bath. But is that concept of bath always uh, fulfilling the scientific requirements of sanitation? Not necessarily, because in the ritualistic concept of bath, the need of making use of a soap or shampoo is not necessary. But if we look at that scientifically in sense of sanitation, then use of a soap or a shampoo is very important, because that will keep the body free from the germs, right? So these are the important attributes. You can have a look on these. Then some of the important sanitation programs. In India, we had several important sanitation related programs. Some of those programs became successful at that point of time, but later on may not left good impact because of several overlapping social practices, right? So for making these programs successful, the kind of changes in the society was necessary. So perhaps those sanitation programs were not having the kind of support that was required from the society at that point of time, right? However, as of now, we can see that there are major changes. So sanitation is not possible technically only through a one-sided approach or only through the government programs. But for that, a major social awareness is required, and a major social mobilization is required. And if, because it is part of the public health, so we have seen that World Health Organization is also talking about organized community effort for ensuring public health, right? So sanitation is not possible without having some kind of organized community effort. So there are several programs like Central Rural Sanitation Program, CRSP. This was started in 1986. Then Total Sanitation Campaign, TSC, it was launched in 1999, right? And these programs have some kind of success, but along with those programs, there were other provisions also, like Nirmal Gram Puruskar. This is related to a kind of award that if a village is maintaining certain requirements, then it will get the Nirmal Gram Puruskar. And then we had the NRHM, that is National Rural Health Mission, and that was also very important in the sense that it talked about the health needs at a very comprehensive level, and it also talked about sanitation, right? So within that NRHM, there were basically village level committees, health and sanitation committees, right? So that way, there were certain structures and certain agencies were created who can take care of the health as well as the sanitation needs. So these Nirmal Gram Puruskar and NRHM did create some kind of positive impact, right? Then we have the Swachh Bharat mission. This is one of the most popular intervention programs launched by the central government, right? So the Swachh Bharat mission is world's largest sanitation initiative, and it was launched by the Prime Minister of India in 2014 to achieve an open defecation free India by October 2nd, 2019. And as we all know, the 2nd of October is celebrated as Gandhi Jayanti. So that kind of understanding was there. It was, the target was fixed to achieve by October 2, 2019 as a tribute to Mahatma Gandhi. Now, how Gandhi is basically related to this sanitation program. Some of you might be aware, or most of you would be aware, that Mahatma Gandhi was very important leader in the sense that he talked about sanitation and he practiced sanitation, and he was very instrumental in breaking some of the barriers related to the perception of having some kind of notion related to pollution and purity with the human feces and urine, right? Gandhi, Mahatma Gandhi, that is Mohandas Karamchand Gandhi, the father of the nation, was not only playing a very crucial role in making the country free from the British Empire, but also playing very important role in making the country free from some of the social problems that we were witnessing. And untouchability was a big problem at that point of time. And the problem of untouchability was basically related with the practice of pollution and purity, and the concept of pollution was related with basically the jobs which were associated with uh, as often stated, scavenging, that means the disposal of human urine and feces, right? So Gandhi has played very important role in modern India for ensuring sanitation and health, and that is why the program Swachh Bharat Mission basically tried to link this program with Gandhi Jayanti. So that is a brief background. I didn't talk about Gandhi before, so that I can talk about it at this point of time. This program, that the Swachh Bharat Mission, led to the construction of over 10 crore individual household toilets, taking sanitation coverage from 39% in 2014 to 100% in 2019, when around 6 lakh villages declared themselves open defecation free. So we had the figures about the programs which were running in 2013-14. So those figures were there, and now we had the Swachh Bharat Mission which got started in 2014, and as of now we have the numbers for the specific years, and we can see that there is a massive growth in terms of addressing the problem related to open defecation. Prime Minister Narendra Modi gave a very categorical message, very clear and straightforward message to the people of India, that India now needs to be free from open defecation. So this Swachh Bharat Mission or Swachhata Abhiyan was launched at a massive level, and most of the institutions of the modern India at some level participated in that, and that is what is basically known as the organized community level effort. So that kind of initiative was taken, and very often we get to know about these efforts, these initiatives taken at different level, and on the basis of that we can say that India has achieved certain milestones in terms of sanitation, right? And that is mentioned in the next important point. While studies indicate that the Swachh Bharat Mission Grameen campaign led to significant economic, environmental, and health impacts, contributing to the empowerment of women in particular, it also led to the achievement of SDG, that is Sustainable Development Goal 6.2, which is related to sanitation and hygiene, 11 years ahead of the stipulated timeline. So this is a very major achievement of India in terms of ensuring sanitation and hygiene in public life. So this is very important component of public health, and if after having this lecture you will get an idea that sanitation is a basic need. It's a very important need. It's a very integral component of public health, and in India there are certain massive level efforts to achieve the targets related to sanitation, and that is very important to know that this is one of the important goals of the Sustainable Development Goals, right? We'll talk about the SDGs in one of the lectures, because that is very important. This is how we can talk about our journey related to having sanitation in our public life as well as in personal life, right? So I hope you will find this lecture interesting. I have mentioned several facts here. Some of those facts may not be necessary to remember for the college students. The research students may find those relevant, but because when we talk about these massive programs, then we need to talk about some of those figures also. So this is all in this lecture, and before we close this, we need to talk about this, think about this, and activity question. So these are visible in your screen. What is the role of sanitation in public life? Think about it. And can you identify the facilities which help in achieving the targets of sanitation in your locality? So this is an activity question. So we will meet in the next lecture. Till then, take care.